An ingrown hair is a skin condition that happens when a hair grows sideways back into your skin instead of rising up from the hair follicle and emerging normally from the skin's surface. This happens when the sharp tip of the hair pierces the skin and continues growing underneath it, or when you wax or pluck your hair, removing the hair completely from the follicle. As new hair grows back, it sometimes gets trapped beneath the skin and continue growing there. When your body detects this hair growing in the wrong direction, it recognizes it as a foreign object, similar to how it would react to a splinter. Your immune system responds by triggering inflammation around the affected area, which leads to the characteristic redness, swelling, and discomfort associated with ingrown hairs. In some cases, the area may fill with pus as white blood cells rush to the site to fight what your body perceives as an invasion. While ingrown hairs can develop anywhere on the body where hair grows, they most commonly appear in areas where hair is frequently removed, such as the face and neck for men who shave regularly, and the legs, bikini area, and underarms for women who shave or wax in these regions. Although ingrown hairs are generally not dangerous, they can be quite uncomfortable and unsightly. They can also cause significant discomfort, especially when they become infected, and can lead to skin discoloration or scarring in some cases. Causes of ingrown hairs. Like what we said, ingrown hairs occur when a hair grows back into the skin instead of emerging properly from the follicle. But why does this happen? Well, shaving is perhaps the most common culprit, especially when using a close shave technique. When you shave, you're cutting the hair at or just below the skin surface, creating a sharp tip. If this newly sharpened hair is curly or grows at an angle, it can easily pierce the skin as it grows back. Using dull razors exacerbates this problem by creating jagged hair tips that more readily penetrate the skin. Shaving against the grain, opposite to the direction of hair growth, provides a closer shave but also increases the risk of ingrown hairs, as it cuts the hair below the skin surface, giving it an opportunity to grow sideways before emerging. Waxing and plucking can also lead to ingrown hairs, though through a slightly different mechanism. These methods remove the hair completely from the follicle. As new hair grows back, it sometimes gets trapped beneath the skin, especially if there's any obstruction at the follicle opening. This is particularly likely if you exfoliate insufficiently after waxing, allowing dead skin cells to accumulate and block follicle openings. Other than that, tight clothing can worsen the problem by increasing friction, which pushes hair back into the skin, especially in areas like the thighs, underarms, and bikini line. People with curly or coarse hair are more likely to experience ingrown hairs because their hair naturally bends and coils as it grows. Finally, hormonal changes with conditions like polycystic ovary syndrome or during pregnancy can also increase your risk of ingrown hairs. Symptoms of ingrown hairs. Ingrown hairs typically appear as a small, round bump on the skin that resembles a pimple. The bumps can be flesh-colored, red, pink, or darker than your natural skin tone. In many cases, you can actually see the offending hair trapped beneath the skin's surface, so it might appear as a small dark spot in the center of the bump. Redness and inflammation around the bump are common symptoms as your body reacts to the hair growing in the wrong direction. Your immune system recognizes the ingrown hair as a foreign body and triggers an inflammatory response, leading to the redness, swelling, and warmth that often accompany ingrown hairs. The area may feel tender to the touch, and you might experience a sensation of pressure or discomfort, especially when wearing tight clothing that rubs against the affected area. Itchiness is another frequent symptom, as the ingrown hair can stimulate nerve endings, creating an itchy sensation that can be quite persistent and annoying. Many ingrown hairs develop small pus-filled bumps as white blood cells rush to the area to fight what your body perceives as an invasion. These pustules resemble small whiteheads and might contain a yellowish or whitish fluid. If left untreated, ingrown hairs can lead to more serious symptoms. Infections may develop, which can cause increased redness, swelling, warmth, and pain. In severe cases, these small infections can lead to larger, more painful boil-like lesions that require medical attention. Over time, recurrent ingrown hairs in the same area can cause hyperpigmentation or darkening of the skin. This discoloration may persist long after the ingrown hair itself has resolved. In some cases, especially with repeated inflammation or improper picking at ingrown hairs, permanent scarring can occur. Treatment for ingrown hairs. Number 1. Stop hair removal temporarily. The first and often most effective step in treating ingrown hairs is to simply pause your hair removal routine in the affected area. This gives the skin time to heal and allows the ingrown hair to naturally grow out of the skin. For many people with mild ingrown hairs, this approach alone is sufficient to resolve the problem within a few days to a week. During this period, it's still important to keep the area clean and moisturized to support healing. Wash gently with warm water and a mild cleanser. Pat dry and apply a non-comedogenic moisturizer to prevent dryness. Number 2. Warm compresses. Applying warm compresses to ingrown hairs is a gentle, effective home remedy that can provide significant relief. The heat from the compress helps in several ways. It reduces inflammation, softens the skin around the ingrown hair, brings the hair closer to the surface, and increases blood circulation to the area, which promotes healing. To create a warm compress, soak a clean washcloth in warm, not hot water, wring out the excess moisture, and apply it to the affected area for 10 to 15 minutes. Repeat this process 3 to 4 times daily for best results. For enhanced effectiveness, you can add a teaspoon of salt to the warm water before soaking the washcloth, as the salt helps draw out any infection and reduce swelling. Another option is adding a few drops of tea tree oil, which has natural antibacterial properties, to the warm water. After applying the compress, you might notice the ingrown hair becoming more visible near the surface of the skin, making it easier to remove if necessary. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 3. Mechanical removal. In some cases, carefully removing the ingrown hair manually can provide immediate relief and promote healing. This approach should be used with caution and proper technique to avoid infection or scarring. Before attempting to remove an ingrown hair, thoroughly clean both your hands and the affected area with soap and water or an antiseptic cleanser. Sterilize any tools you plan to use, such as tweezers or a sterile needle, with alcohol or by boiling them for a few minutes. Apply a warm compress for 5 to 10 minutes first to soften the skin and bring the hair closer to the surface. If the hair is visible beneath the skin but hasn't broken through, you can use a sterilized needle to very gently free the embedded end. Insert the needle under the loop of the hair or at the point where it re-enters the skin, lifting slightly to release it. Once the tip of the hair is exposed, use sterilized, pointed tweezers to gently pull the hair straight but not completely out. The goal is to straighten the hair so it grows in the correct direction, not to remove it entirely. If the hair is already partially exposed above the skin, carefully grasp it with tweezers and straighten it without plucking. After freeing the hair, apply an antiseptic like witch hazel or a small amount of antibiotic ointment to prevent infection. You should totally avoid this method for deeply embedded hairs, severely inflamed areas, or if you have multiple ingrown hairs covering a large area. Never dig into the skin to find a hair that isn't visible, as this can cause significant trauma, infection, and scarring. If the ingrown hair is deeply embedded or surrounded by significant inflammation or infection, it's best to seek professional help rather than attempting removal yourself. Number 4. Gentle exfoliation. Regular, gentle exfoliation is key to both treating and preventing ingrown hairs by removing the dead skin cells that can trap hairs beneath the skin's surface. You have 2 options for doing this. Physical exfoliation uses scrubs, brushes, or exfoliating gloves to mechanically remove dead skin cells. When choosing a physical exfoliant, opt for products with fine, smooth particles rather than rough, jagged ones that can cause micro tears in the skin. Chemical exfoliation, on the other hand, uses acids like alpha-hydroxy acids or beta-hydroxy acids to dissolve the bonds between dead skin cells, offering a gentler alternative that's often better for sensitive or already irritated skin. Products containing glycolic acid, lactic acid, or salicylic acid can be particularly effective. For the face, exfoliate 1 to 2 times per week. For the body, 2 to 3 times weekly is typically appropriate. Now we want to hear from you. Have you ever struggled with stubborn ingrown hairs? What methods have worked best for you to treat or prevent them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.